Nestled in the scenic Appalachian Mountains of Leslie County, Kentucky, the Frontier Nursing Service has an 80-plus year history of offering family-oriented healthcare to rural populations. Mrs. Mary Breckinridge's vision of educating specialty practice nurses ultimately evolved into the Frontier School of Midwifery and Family Nursing. Today, as one of the leading distance education nursing institutions in America, the Frontier School maintains its focus of training nurses to serve rural and underserved areas where their experience and education will do the most good.
Our mission is very clear and connects back to the work of Mary Breckinridge in 1925. Our mission today is the same as it was early on, to educate nurse midwives and nurse practitioners to serve families in rural and underserved areas in America and all over the world.
When Mrs. Breckinridge started the Frontier Nursing Service, she did so in an effort to create a demonstration project that could be replicated elsewhere, bringing health care to folks that might not otherwise have access to it. She decided the best way to do that was to use nurse midwives functioning not only as maternity care providers but also as public health nurses. The concept was to bring health care to people where they were in life rather than to have people be forced to access health care according to the system's terms.
This log home in rural Kentucky was built in 1925 by this woman, Mary Breckinridge. Now listed as a National Historic Landmark, the home is as sturdy as always, but it is not the strongest entity this visionary nurse midwife ever built, for it was in this very home where Mrs. Breckinridge founded the Frontier Nursing Service, an innovative healthcare service that used nurse midwives traveling on horseback to homes, providing full-scope healthcare to families in the mountainous regions of southeastern Kentucky. The original plan included a school to educate nurses to be both public health nurses and nurse midwives. That plan was put into operation in 1939 with the implementation of the Frontier School of Midwifery and Family Nursing.
While Mrs. Breckinridge always had a plan to open a school to educate nurse midwives and public health nurses, the plan became more important after the Great Depression, when it became clear that the financial resources of the Frontier Nursing Service were not going to allow us to corporately expand into other areas. And so what the graduates of the school did were able to take the teachings and the methods of the Frontier Nursing Service and replicate its model of care in their own communities.
A recognized innovator in the field of graduate nursing, the Frontier School offers the oldest and largest continually operating nurse midwifery program in the United States. In 1970, Frontier further solidified its position as an education leader by offering the first family nurse practitioner program in the country. Designed to replicate the Frontier Nursing Service model of care, Frontier-educated nurse midwives and nurse practitioners carry on the mission of Mary Breckinridge by bringing quality health care into their own rural and underserved areas of need.
We offer distance education. Today it is offered over the internet. All students do come here for an orientation session of 4 days to start their education, and then they go back to their homes and they study using the internet. We have 55 faculty members all over the country who work with these students over the internet. And then after they've done most of their didactic or coursework, they come back for another 1-week experience here to prepare them to enter clinical. They actually go to clinical sites located in their communities all over the country again, where there are expert nurse practitioners and nurse midwives who are on faculty at Frontier who educate them in the clinical regard. We offer a Master of Science in Nursing with tracks to become a nurse midwife, family nurse practitioner, or women's health care nurse practitioner. We also offer a Doctor of Nursing Practice, which is postgraduate, and we also offer a bridge program, which is for students who have an ADN degree and want to bridge into the master's program.
Mrs. Breckinridge wanted to create a service in an area that was very underserved and frankly very inaccessible to prove that if it could be done here, it could be replicated anywhere. And no one could say that their terrain or conditions were worse than that she had founded her own service in.
Graduates of the Frontier School of Midwifery and Family Nursing stand poised to fill the preventative and primary care need of Americans in the 21st century and beyond.
Well, I knew I wanted to be a nurse midwife when I went with one of my friends for her first gynecological visit, and she had been having some problems, and she received such excellent care from a nurse midwife, and that just showed me that this was the profession I wanted to go into. And when I found nurse midwifery, I realized it was the perfect profession because as a nurse midwife, you're focused on giving women care in a way that respects them, loves them, and empowers them, and it just seemed perfect. As I had looked into many programs and actually been accepted into several programs, but this was the only program that when I met people who had gone through this program, they said they were trained in a way that really made them prepared to come out and serve as nurse midwives in an excellent way. And I really hadn't heard that from anyone else, and so that just excited me about the program. It made me feel that I'd be making the best choice.
We get incredible feedback that students are very appreciative to have had the opportunity to attend graduate education even though they live in a place where they really cannot get to a university. They also feel like they have received a very high level of education and feel very accomplished and ready to enact their role as an advanced practice nurse. Also, we have surveys of employers who consistently tell us that our students are, at the time of graduation, hit the road running and are ready to take on the role.
The level of education and preparation I'm receiving is excellent. We spend a great deal of time on the theory of midwifery and understanding that philosophy, as well as understanding evidence-based care and how to get the most up-to-date evidence so that you can incorporate that into your care. Nurse midwifery is a wonderful journey, and the Frontier School is a wonderful place to start that journey because of the focus on building who you are as a midwife, understanding how your unique personality, your unique understanding of your clients can make a big difference in people's lives.
We're very excited about our future. We have been growing tremendously in the last few years and we expect that to continue. We are planning a new building. This is very critical as we're very proud of our historic buildings and we plan to maintain them, but we need additional facilities and space. One part of this project that we think is very exciting is that we're going to have some simulation labs specifically designed for nurse practitioners and nurse midwives. They include clinic facilities and also some birthing rooms where the students can actually practice becoming a nurse midwife or a nurse practitioner. We believe that nurse midwives and nurse practitioners are an essential part of the solution to improving the healthcare system in America. That is what we're trying to do here. We're trying to change the world to make it a better place for families.
I think Mrs. Breckinridge would be very pleased to see that so many folks have come through and dedicated their lives to service in their own underserved communities. She often said our goal is to see ourselves surpassed, and I think that she would very much feel that is what has happened since she left in her time at the Frontier Nursing Service. Her work is alive and well just as she intended it to be.
Learn more about Frontier Nursing Service and the Frontier School of Midwifery and Family Nursing today, providing primary health care in Eastern Kentucky and distance education from the birthplace of nurse midwifery and family nursing in America. For more information, log on to frontierschool.edu or frontiernursing.org.